Hey, this is Dr. Meyer coming to you from East Bay Disc Centers in Concord, California. Wanted to chat real quickly about cortisone injections, or what you might know as a steroid injection. Lots of doctors recommend these for their patients, and when our patients come in here, many of them have been recommended to have them for problems like a shoulder, like a frozen shoulder, or chronic pain or inflammation. Could also be in a hip, a knee, an ankle, in the spine, even in the neck. And what I want people to understand is that we should never consider that these shots are just completely safe. They are not. They are a hormone, and we should know what the hormone levels are before we're injecting any additional hormones. But beyond that, sometimes the shot actually does help, but I'm going to tell you more often than not, the reports that we get and the data really suggest they do not help. So you wind up getting the first one, and you're still in pain or you still have the inflammation. The doctor says, well, we can do a couple more. So you go back and have the second shot. Sometimes that helps, sometimes it doesn't. If it doesn't, you may have pain at the injection site. You may have a negative reaction. If it does help, terrific. But I like to see these used only as a last resort. There are many other things that we can do naturally, safely, that don't have any potential for long-term damaging effects. There's a growing body of evidence that suggests that cortisone injections can actually promote autoimmune disease. We don't want to be messing with our immune system and creating illnesses that we never had to have. Additionally, we do know without a doubt that cortisone injections are damaging to ligaments, tendons, muscles, and joint material. So although they may bring you some relief temporarily or help you get over a pain syndrome, which is wonderful if that happens, but they can actually cause damage to the joints. And so 5, 10, 15 years down the road, you don't want to have new problems. You don't want to have degenerating joints. You don't want to have a joint replacement, knee, hip, etc., because the steroid shot contributed to destroying the joints. So I urge you to please use caution. Before you say yes to getting any of these shots, check with us. Come in, find out what else can be done. We might have a solution. It could be nutritional, it could be activity-wise, it could be chiropractic adjustments, it could be using our system called PEMF or laser. There are just so many options here, so I urge you to be cautious. I'm going to attach a link to an article I wrote on steroid injections recently. We'll put that in the text below so that you can check that out in our blog section of our website. I hope this is helpful. Have a terrific day. We'll see you soon.